Hello from Dartmouth-Hitchcock. I'm Ed Merrens, the Chief Clinical Officer for Dartmouth-Hitchcock Health, and it's great to be back for an update of where we are with our healthcare and our response to COVID-19. I would say at the outset, it's been a long 8 months, and I think that we're all feeling it in different ways, and I want to reflect on the response from healthcare, where we are, and how we're here to take care of you with all your healthcare needs. I think as we reflect over the past 8 months, this was initially marked by a time when we needed to work on training and getting necessary PPE to provide safe and effective care. This was the situation across the United States with many academic and non-academic centers, and we really took the approach of supporting our entire Dartmouth-Hitchcock Health system. I'm happy to report that since the early spring, we've been in a situation in which we have adequate supplies, training, and protection for our staff, and most importantly, our patients. Now we're in this either new normal or new reality in which we're having to do all the things that COVID requires alongside all the normal work that we do. And we feel really proud around the resumption of normal services and procedures and care that has now gone on for months. People have been able to safely have babies and receive needed cancer care. We've even done our first CAR-T therapy, managing the care of highly immunocompromised patients in incredible ways. And this is a testament to our teams, our lab, our clinicians across Dartmouth-Hitchcock Health that we're able to continue to provide this level of care. So I think the question that a lot of people have is, what's next? What should we expect? As we head into colder weather and as the modeling shows, and as we look across the United States, we do expect some degree of a surge in COVID-19 as we head into the fall and into the winter. We've had an increase in the number of cases in New England on the order of what we were experiencing in the spring, but not the same degree of hospitalizations. Yet we are not letting down our guard at all, and we're staying prepared and vigilant for what might come and being able to take care of patients and our system if that's the case. We will continue testing, we will continue our efforts at providing care and constantly reflecting on what's best for our patients. We have state and institutional travel policies, and we're constantly looking at our visitor policy as well. And if you do have a planned visit, check ahead on our website, dh.org, to see if there are any updates to the visitor policy. Again, any changes to our visitor policy is around delivering the highest degree of safety to our patients and staff. We know that across the United States, 12 million Americans are unemployed. We know people have lost health care. We know that there are rising rates of anxiety, depression, and suicide. We're keenly aware of the impact across the United States and our community. We know that people are facing food insecurity and lapses in healthcare. We want to be there for all this, and we understand that. And efforts that we've made in terms of coordinating with communities through our population health group, through psychiatry, and our outreach are designed to understand these efforts and understand the impact on your health. We keenly understand these, and if there are any issues that arise, that you know someone in your family, in your community, at work that is suffering, there are opportunities to receive help, and you can reach out to us at Dartmouth-Hitchcock and in your community for that support. We know that it's not just the situation in terms of employment or healthcare, but we realize that the situation with COVID-19 has become a highly politicized issue, which has not helped anything as we continue to battle a pandemic as a country and as a region. We've had the worrisome subjugation of scientists and healthcare leaders in this process, and I would ask all of you to do whatever you can to understand that science requires understanding and it is not a subject of belief. We are working diligently and feel very strongly that wearing a mask, washing your hands, and maintaining social distancing are the efforts that we feel can prevent the spread of COVID-19, to protect you, your families, and those in your community that could be most at risk. I think it's really important that we all reach out and maintain social connections. We know in a couple days the clocks are going to fall back, and we're going to lose another hour at the end of the day that we were counting on for maybe that walk outside or a little bit of light. And we know with everything that's happened, this is a challenging time. And it may not just be the light that's growing darker. People sometimes get the winter and fall blues, and this is a time where so much else is contributing to that. And maintaining social connections, reaching out to friends and families and coworkers is really important. I think it's really important during this time to make sure that you're immunized against the flu. We know that the symptoms of influenza can mimic those associated with COVID-19, and we want to make sure that people that can get a flu shot do get a flu shot to reduce both the severity of the illness or actually contracting influenza. Finally, we want you to vote. We want you to vote, and those of us as part of a academic health system want you to think about your health as you vote, and know that it's safe going to polling places and exercising your right to vote, and encourage you to do so. I want everyone who's thinking about being inside during these times to think about a new hobby. I think we've gone through sourdough and indoor gardening and a whole range of things, and maybe there are puzzles available now, but think about new ways that you can enjoy time together. Find time to get outside, even briefly. Time outside, brief exercise, seeing the light can contribute to all of our well-being, and I encourage everyone to find time to do that. I want to finally end with saying that we want to wish all of you, your family, and your communities the best as we go forward. If you need us at all, you can reach out to us at dh.org or at 603-650-1818. All the best.